Hi, this is Jessica DaMassa with WTF Health, and I am here at the Bayer G4A Accelerator in New York City. Joining me right now, I have Dr. James Glichnik. He is the Biomedical Advisor for Galileo Group, which is doing some really exciting things in Health as far as dermatology is concerned. So tell me a little bit about what you guys have going on here, because it was really fascinating from a very technical standpoint.
Thank you, Jessica. Appreciate this opportunity. So our interest is in using just a standard cell phone for developing 3D images that can be then temporally aligned, which essentially allows us to see changes over time in various skin conditions, which can play a major role in following acne, treatment response for something like psoriasis, mold detection, and things along that line. We also have the ability, beyond just using a standard cell phone, to add attachments that might actually help us see light that's reflected directly from the surface or is coming up from underneath the surface, and to look at different wavelengths.
Okay, I'm going to ask you to unpack this because that's a lot of information. So let's go piece by piece. So, like, what are you guys adding to the cell phone? Is it like a device, or what is? And why do we need to add something to the cell phone camera at this point to help do what it is that you want to do?
Right. So at a basic level, the cell phone itself is very powerful. So we can look at 3 color channels on a standard cell phone. We can get 3D information that can then be temporally aligned. So there's a lot you can do with the standard cell phone. However, if you do want to look at just the light reflected from the surface, you do need to add polarizing filters. If you want to look at the light that's coming up from under the surface, it's not coming from the top, you also need to use similar filters.
Okay.
And if you want to look at particular wavelengths, you're trying to sort out, is the blood oxygenated or not oxygenated or something else along that line, you may need to use particular light to be able to get that information back, and we can control that light.
And why is that important if you're somebody on the other side of this, a dermatologist, looking at a photo or a 3D capture of somebody's skin?
So when a patient shows up in the clinic, really that is just a point in time. So by having information that actually shows you how this lesion has been changing over time, you can be a better diagnostician. You know, you'll know whether that condition is getting better or worse, and how it's changing, which just it'll allow us to practice medicine at a higher level.
And as far as, like, even with the cost of things, I would imagine it's a lot less expensive for someone to scan themselves using a device on their cell phone than to come into the office for regular checkups.
Exactly, and it certainly opens that whole telehealth space too, where, you know, not only sending a 2D image, now you can actually send a kind of a 4D file that's 3D, see how things are changing over time, and further we could even break out some of the spectral data, which might help in diagnostics.
That's excellent. And so, I mean, I guess as far as the future of this space is concerned, I mean, Health has been a little bit difficult. You know, it's gotten ups and downs and things like that. So how do you see the space evolving, I guess, moving forward, especially from a physician perspective?
You know, it'll be a process.
Yeah.
And I think we're all moving more and more into that 3D realm. You know, people have their VR headsets. We're beginning to get more and more comfortable with that. I think healthcare as a field is changing a lot, from maybe just the individual physicians to basically having huge networks. And as we move to that, I think we're going to have more integrated computer systems. We're going to have better data. We're going to be applying algorithms and AI to try to make better diagnoses. In order to do a good job of that, you really have to have good data, and our objective here is to basically provide very good, clean baseline data upon which to improve healthcare.
So if anybody wants to learn more about your solution, what is your website?
Galileo-gp.com.
Awesome. Thank you so much for joining us. It was a pleasure to speak with you. It's exciting stuff that you're doing in this space. Thanks a lot. This is Jessica DaMassa with WTF Health.